Hi, this is Dr. Fruth, family physician, and this is today's consultation. Mosquito season is here, and those tiny little insects can deliver much more than just an aggravating itchy bump. When that needle-like sucking mouthpiece pierces your skin to gorge on your blood, it can inoculate you with 100 other little tiny beasts. Many of those microscopic organisms have been known for ages. In fact, malaria has been recognized for tens of thousands of years, and humans who have lived in malaria endemic areas have actually had changes in their red blood cells that have allowed them to have increased survival after being infected with the parasite that causes malaria. And you may have heard of some of the other mosquito-borne illnesses like yellow fever, dengue, West Nile virus, and that one that's fun to say but bad to get, chikungunya. Well, there's a new mosquito-borne virus on the horizon, and that's the Zika virus. The Zika virus was first identified in Uganda in 1947, and in 2007 reported to cause diseases in humans. Beginning in 2014, it was recognized that mosquitoes carried the Zika virus, and as of March 2017, 61 countries have reported Zika virus transmitted by mosquitoes. Unfortunately, the evidence is mounting that transmission of the Zika virus during pregnancy can have terrible outcomes for the infant, including babies being born with very small brains, misshapen skulls, joint problems, and eye problems. Now, this transmission occurs when the woman is infected with the Zika virus during the first 6 months of pregnancy. But fortunately, only 1% to 13% of the infections do cause adverse effects in the unborn child. Americans who have contracted Zika virus while traveling to endemic areas have been identified in all of the states except for Alaska. And there have been a few primary outbreaks reported in Texas and in Florida. The Aedes mosquito, which causes or carries the Zika virus, has a distribution in the United States that is pretty widespread, so it's expected that there will be some more primary outbreaks of Zika virus in the United States. Mosquitoes aren't the only vector for the Zika virus. As I mentioned before, a mother can transfer the virus to the unborn child during pregnancy. Blood transfusion is another potential way the Zika virus can be transmitted. However, in the United States, all blood products are now screened for Zika virus. But transmission can also occur during sex without condoms. In fact, the Zika virus has been isolated in the semen of men infected with Zika virus up to 69 days after the infection. If you're infected with Zika virus, there's a good chance you're not even going to know it. Only 18% of the people infected with Zika virus even get symptoms, and they're pretty typical for a viral infection, including fever, rash, some joint aching, and eye irritation. And the treatment is only supported that of taking fluids, rest, and in this case, acetaminophen or Tylenol. Well, the CDC recommends testing for individuals who have specifically traveled to a Zika active area or have had sex with someone who did, and have symptoms consistent with Zika viral infection. However, if you're pregnant, travel to an area where there's active Zika virus transmission, or had sex without condoms with someone who did, you should be tested for Zika virus. Your obstetrician should be asking about potential for Zika virus transmission at every OB appointment. If you feel you need to be tested for Zika virus, your physician should follow the CDC recommendations about testing, because depending on when your potential exposure is, urine test that's positive does mean that you have been infected with Zika virus, but a negative urine would need to be followed up with a blood test to be sure to see whether or not you have Zika virus infection. The only prevention for Zika virus transmission now is avoiding the mosquito bite. There's no immunization. So especially pregnant women should avoid travel to Zika active areas, should use air conditioning, screens, mosquito netting, and wear long sleeves, long pants, and wear insect or mosquito repellent. So if you have concern about Zika virus or Zika virus transmission, Contact your family physician for recommendations on whether or not you should be tested. This is Dr. Fruth, family physician, and this is today's consultation. These videos are for educational purposes only, so please contact your personal healthcare professional for your personal healthcare needs.